Hey guys, welcome back to Medical Coding with Blue on Patreon. Okay, so today is more of the modifiers series. I am talking about modifier 57, which is decision for surgery. I will be leaving the link for the websites that I'm going to be reading from in the description box of this video. I'm going to be reading from the Novitas website and from carecloud.com. So CareCloud is going to give us some examples. Novitas is going to fill us in on the FAQ of this wonderful modifier. So let us begin. All right, modifier 57, what you need to know. Modifier 57 is used to indicate an evaluation and management service resulted in the initial decision to perform surgery, either the day before a major surgery, so like within 24 hours, major surgery being a 90-day global surgery, or the day of a major surgery. So the appropriate uses: append only to the E&M procedure code where the decision to perform surgery is made the day of or the day before a major surgery during a E&M service. Okay, so if the provider decides on this one particular visit that he is going to do surgery, or a procedure that has a 90-day global period on it, either the same day or it's going to be within 24 hours, like on the next day, then that evaluation and management service will get a modifier 57 on it, because it will say that during this visit, the decision to put the patient under this 90-day global procedure or the surgery was made. Now, if the same provider said, well, I'm deciding to do surgery today, but the surgery will not take place until a week later, then you would not use modifier 57, okay? So it is very specific in the time that you can apply this modifier 57. The decision for surgery has to be made either that day and the procedure is performed that day, or the procedure is performed the very next day within 24 hours. So that is something that you need to know. So pay attention to those details because it's really going to make a big difference. And when you're doing like any kind of claim submission, things like that, having the appropriate modifiers is going to be the difference between having a bill paid cleanly and a bill being kicked back, right? And a lot of revenue potentially being lost because of applying the wrong modifier. So that is what we are going over today with modifier 57. So the inappropriate uses of modifier 57 is appending to a surgical procedure code. So if, for example, the provider is performing an initial fracture reduction, you would not apply that modifier 57 to that fracture reduction procedure code, because it's only applicable to evaluation and management codes, okay? So for example, like 99203 or 99204, 99205, those like outpatient, outpatient E&M visits, right? And just this example, there's a bunch of E&Ms that this can apply to, but just for an example's sake, 99203, 204, 205, okay? Think about that. Okay, the next one is appending to an E&M procedure code performed the same day as a minor surgery. So a minor surgery being a global period of 10 days. Okay, you would not report a modifier 57 on the evaluation and management for something like that. So a lot of times when you're looking at which one is major, which one is minor. So minor surgical procedures are ones that have a 0 to 10 day global period on them, right? And if something like this is happening, that's going to be something different, okay? Because there is a component of evaluation and management already built in to minor procedures, the decision for minor procedures. So that I'm going to go into on another video. I don't want to get too crazy with the different modifiers, so I kind of want to stay focused. But modifier 57 is only for those major 90-day global procedures. Now, if you're wondering how long is a particular global period for a particular procedure, there is a link. I believe it is on this one. Yes, the Global Surgery Calculator. So you can be able to click the link. you'll be able to put in the procedure code for whatever procedure you're trying to look up, and it will tell you what the global period is for that particular procedure. So very important to know. And the next one for inappropriate uses is when the decision to perform a minor procedure is done immediately before the service, it is considered a routine preoperative service and is not billed in addition to the procedure. That is getting into modifier 25. And again, I will have to go into that on another video because that is the catalyst for a lot of arguments. A lot of arguments between providers and coders, and a lot of arguments between billers and coders. So we'll have to get into that on another one. And the next inappropriate use, do not report on the day of surgery for a pre-planned or pre-scheduled surgery. So again, in the instance of the provider deciding that day to do surgery 2 weeks from now or a week from now, that's already a pre-planned surgery, correct? So you would not use modifier 57, even though he decided to do surgery. He did not do surgery on that same day or within 24 hours. He's doing it 2 weeks from now. So that's when this modifier 57 does not apply, okay? He may have decided, but because of the time constraints, he did not meet those, right? It's further in advance, so that is when you would be like, oh, okay. That is when decision for surgery would fall into the medical decision making for the evaluation and management code. That can be the difference between being a level 3, being a level 4, or being a level 4 and being a level 5. So it's depending on the documentation and what all is happening. So that is something to know, okay? And then it says, do not report the day of surgery if the surgical procedure indicates performance in multiple sessions or stages, okay? And then facts. Global period includes the day before surgery, the day of the surgery, and number of days following the surgery, which is 90 days if it's a major global procedure, right? Note, a major surgery has a 90-day post-operative period, and a minor surgery has either 0 to 10-day post-operative period, okay, just so you know. Preoperative period is the day before surgery or the day of surgery. So when you're looking at these, right, and they're coming in and they're saying, okay, we're going to decide to do surgery today, and we're going to check them out right now, and we're going to set them in this cast because that's a major procedure, right? So we're going to go ahead and set them in this cast. That decision for surgery happened on that same day. Okay, so that's when, again, you're using that. But the global period is the day before that, the day of, and then the global period immediately following afterward. So just something to know. It's a little kooky, yes. But when you think about it, you know, it makes sense. Or at least it will eventually. Preoperative period is the day before the surgery or the day of surgery, okay? E&M service resulting in the initial decision to perform major surgery is furnished during the postoperative period of another unrelated procedure. Then the E&M service must be billed with both 24 and 57 modifier. So 24 modifier we covered in another video. And then, like I said, I want to kind of stay. But yes, just so you guys know, if it has nothing to do with so with a modifier 24, let me go ahead and explain it. So modifier 24 is an evaluation management service that occurred during a postoperative period about something unrelated to that procedure, correct? And if the provider decides this is a separate service, okay, from this major surgery that they're in, and they're deciding to do a decision for surgery also on this visit, right? Because something catastrophic happened, so they decided to do surgery either that same day or within 24 hours. then you would append modifier 24 to the E&M service to say that this is completely separate from being in this global procedure, this global package, right? With modifier 57, because 57 means decision for surgery the same day or within 24 hours. So hopefully that makes sense to you. With having multiple modifiers, you have to be careful, because if they are applying, then you need to apply them appropriately. So the idea of how do you sequence the different modifiers, right? So the more informational, a good tip, right, is the more informational the modifier, like whether it's directional, left or right, or bilateral, if you're able to use a 50 modifier, those are going to be at the end of procedures, right? This is going to be, this evaluation and management, something completely separate. But when you're looking at like procedure codes, like when they're actually doing like a surgery or something, you're going to look at what's going to affect their money. So if it is a reduced service because something happened and you have to put a modifier 52 on it, obviously you wouldn't report the directional thing first, right? Because that's more informational. That 52 is going to affect the payment because they're not going to receive full payment because it's a reduced service. So that is why you would put modifier 52 first, and then you would put your left or right or 50 modifier. So that is just something to kind of put into your head. With the E&M service, now the 57 is considered informational because it's telling the insurance company, hey, a surgery was decided on this day. But this 24 modifier is going to affect the money because this 24 modifier says that this evaluation and management service is during a global period that this patient is in. So all these visits should be covered, right? But because this is something completely separate, we're identifying it with a 24 modifier. So that's telling the insurance company, hey, you have to pay something different for this because this is occurring during this time. You're going to give them money when it's typically not being given money because it's related to the procedure or something like that. But this is completely separate. So 24 first because it's affecting the money, and then 57 because it is informationally letting us know that a procedure was decided to happen either that same day, major procedure, by the way, either that same day or the next day. I hope this makes sense. I hope I'm not going too fast. But yes, that's what that means. And if you're lost on it, it's right here. I'm reading from the website. So I'm going to read from CareCloud. And this is really good. This is because it's got examples for you guys. So it'll tell you more about 57. So it says procedure coding, when to use the 57 modifier. Excuse me. This is part of the modifier series. They have more articles. So if you choose to look at more of these, that's cool. The 57 modifier is an ongoing source of confusion for physicians and medical staff alike. But it is not so difficult once you really understand how they should be used. It is more of just another informational modifier. See how I said that right? just now? It actually affects reimbursement, right? So correct use of modifier 57 is similar to how modifier 25 is used. A modifier which you may be more familiar with and was examined in another article in this series. Whereas modifier 24 is more appropriate for E&Ms performed in addition to minor procedures. This is when there is something completely separate from this minor procedure going on. Okay, so again, I'm going to have to get into that in another video. But reading on, the modifier 57 is reserved for E&Ms that result in major procedures. Let's take a moment and review when it is correctly used, the modifier 57, to ensure your practice is getting paid for their services that they render. Defining modifier 57. It is generally understood that modifier 57 applies to an E&M from which a decision for surgery has been made by the physician, But there's something more you should know. Surgical procedures aren't the only procedures where Modifier 57 can and should apply. In fact, the CPT manual states that Modifier 57 can be used on any E&M during which a physician decides a major procedure is necessary. While the CPT manual does not specify major in these instances, CMS does, and CMS sets the standard for payer guidelines. Per CMS, a major procedure is a procedure with 90 global days. And as we know, that procedure may or may not necessarily be surgical in nature. For example, like setting a patient in a cast, like a manual reduction or even a closed treatment without manual reduction. That is considered not typically surgical in nature because they're not going to the OR, but it is considered a major surgery because it has a 90-day global period on it. All these visits are going to be covered for this broken bone treatment, right? As mentioned before, it may help to think of Modifier of 57 is the 25 equivalent when it comes to getting pre-surgery E&M paid. This is because if a major procedure is done and the preceding E&M was lacking the 57 modifier, the payer will assume that the E&M is inclusive of the other services billed and will not pay it separately. Okay, so that is something to know. That's why if that decision was made on that day, then you have to put that 57 so that way they know, oh, okay, we're going to do this today. And that's why the 57 is so important. Let's see. Important points. Initial evaluation prior to major surgery and or procedure is always payable. Modifier 57 should be appended to E&M service on the day of or the day before said procedure when the E&M service results in the decision to go to surgery. This informs the payer that the physician determined that the surgery was medically necessary. Modifier 57 should only be appended to E&M codes. Okay. Clinical scenarios. Example 1. A surgeon sees a patient in the emergency department, then performs CPT code 65285, which is repair of a laceration, cornea and or sclera, perforating with reposition and resection of uveal tissue. I said it right. I'm excited. Uveal tissue on the same day. Since this surgical code has a 90-day global period, the correct way to bill the E&M for separate appropriate payment is 99284 with the 57 modifier, emergency department visit for evaluation and management of a patient, and 65285, depending on, right? So that's the procedure code that they're using, right, for that. But it's for repair of laceration, cornea, or sclera. Obviously, you want to know which side and then append that RT or LT modifier, okay? Example 2, an orthopedist examines their patient and discerns the need to perform non-surgical fracture care. Close treatment of a clavicle fracture, whether CPT 23505 with manipulation or CPT 23500 without manipulation, is not technically surgical in nature, but it is a major procedure that has 90-day global period. In this case, separate payment of an E&M service with a modifier 57 is appropriate, okay, because it is considered major surgery. Example 3, a patient presents to the emergency department with abdominal pain and fever. The consulting surgeon documents a level 3 outpatient consult and decides that at that visit to perform an emergency appendectomy. The appropriate coding for payment for the preceding E&M is 99243 with the 57 modifier and 44950 for the appendectomy. Okay. And then incorrect use of modifier 57. Appending to a surgical procedure code, which obviously you would not do because again it's for E&M. Appending to an E&M code performed the same day as a minor surgery or procedure. Okay, so something else to think about. Okay, obviously you're not going to report the E&M with a modifier 57 if they did a steroid injection, right? Because obviously that's not a major surgery. That is a minor procedure with a 0-day global period on it, okay? Which means the E&M is already built in, okay, for whatever they're managing that injection for, okay? Just saying. Reporting on the day of surgery for a pre-planned surgery. So as we said before, if they decided to do it in 2 weeks, then obviously 57 modifier does not apply, okay? Reporting on the day of surgery that will be performed in stages or in multiple sessions. Reporting on the E&M for the decision for surgery, but the surgery is scheduled in 2 or more days. So again, in the future, okay? Final thoughts. Separate payment for an E&M service prior to a surgery by using modifier 57 is appropriate when properly documented. Remember to use modifier 57 when the decision was made to move forward with a major procedure in order to be compensated accordingly. Familiarizing yourself with modifiers like 57 that are applicable for your provider and or practice will ensure not only that the modifier is used appropriately, but that you secure the reimbursement you're owed. Okay, so I thought this was a really good article. Who wrote this? Does it say who it's by? It does not say who it is by, but it's from carecloud.com. But very good article, very well written. I like it, and this video is getting long, so I'm gonna go ahead and upload this. But I hope you guys enjoyed this brief explanation of modifier 57. I will see y'all on the next video. Bye.